When CTV News reported on the top 10 causes of death in Alberta in 2021, this is the chart they showed you. I queried the same data and this is what's actually in the database. The deception begins when the very first word from the database, other, is omitted from public reporting. Why? I'd imagine it's for the same reason organic, was removed from dementia, virus identified, from COVID-19, and, all other forms of, from chronic ischemic heart disease. In each case, the manipulated names are suggestive of additional, unreported deaths. In fact, the publicly reported top 10 list accounts for less than a half of all deaths in 2021, while the majority of deaths are reported under an additional 288 cause names. As a community service, I organized all 298 causes of death into 16 meaningful categories to get a clearer picture of the data. Now we see cardiovascular disease, claiming over 8,900 lives, was the actual leading cause of death in Alberta in 2021. Reported by Alberta Health Services under 64 different category names, and by the media under only 4. Next were over 7,000 cancer deaths, accounting for nearly a quarter of all deaths. These were reported across 77 different categories, only one of which featured an Alberta Health Services media manipulated top 10 list. Turns out deaths from unknown causes, aka, all other symptoms, signs and abnormal clinical and laboratory findings, not elsewhere classified, aka, not specified, aka, all other and unspecified events of undetermined intent and their sequelae, was the third leading cause of death in Alberta in 2021, with over 1 in 10 deaths being so classified. In fourth place is neurodegenerative diseases, where we learn that, despite prime ministerial assertions to the contrary, only a single Albertan expired due to mental retardation in 2021. COVID-19 doesn't show up until fifth place, where it accounted for about a half of all deaths from infectious disease in 2020, and 2/3 of infectious disease deaths in 2021. Or, to put it another way, there were about 1,000 additional infectious disease deaths in 2020 and about 1,700 in 2021. Now, what if there were some way to prove that some, if not most, or even all, of these 2,700 excess deaths from infectious disease, should have been listed elsewhere? Well, it turns out there are several ways to do this. I'll begin by showing you one of the least consequential, yet most easily provable examples first. More will follow. Example 1. Murder. It is well documented by both governmental and media sources that 139 Albertans were victims of homicide in 2020, as were 118 in 2021. And yet, the 8 categories used to report homicide in the official mortality data, in each of these 2 years, tallied only 38 and 13 respectively. Where have the deaths of these 206 murder victims been recorded?